Welcome everybody. My name is Eric Wellen. I am a team member here at Praxis Research Foundation, and I'm also a parent of two wonderful boys with Fragile X. So this day, World Fragile X Day, holds a very special day in my heart. Today we have Dr. Carrie Buchanan joining us. She's going to be talking about anxiety, and I will turn it over to Carrie, and we can go from there.
Wonderful. Thank you so much, Eric. Thank you for the introduction. I'm really excited to be here, especially on World Fragile X Day. So, as Eric mentioned, I am a physician. I'm a developmental behavioral pediatrician at the Greenwood Genetics Center in Greenville, South Carolina. And I've really been involved in the Fragile X space for close to 10 years. So I'm excited to be here today specifically talking about anxiety. I'm just going to give you a quick background. I currently direct the Fragile X Clinic at the Greenwood Genetics Center. I'm the principal investigator on several clinical trials involving Fragile X syndrome, and our center is actually a participating site in Forward March, the Fragile X Natural History Study. And I wanted to say all this, excuse me while I just move this around so I can see my slides. I wanted to mention my background specifically to kind of highlight my own personal connection to Fragile X syndrome. There are really so many families and individuals affected by Fragile X syndrome that are very dear to me. So today I really want to stand with these families and with all of you to celebrate those, I think as the FRAXA website says, to those who shine in the face of Fragile X syndrome. And so I'm here today celebrating my families, my patients, and all of you as well. So thank you guys for being here, and again for having me. So again, as I said before, today I'm going to talk specifically about anxiety in Fragile X syndrome, and really its many manifestations. Anxiety is a very important topic in Fragile X. As most, if not all, individuals with Fragile X syndrome experience anxiety, and many experience very high levels of anxiety. I think what's especially important in Fragile X syndrome is the recognition of the many different ways anxiety can manifest. So, in our kiddos, we see, or I say kids, all ages here, right? So from young childhood to adulthood, I'll just say our children, our kids, we see irritability, we see aggression, perseverative behavior, perseverative thoughts and questions, reassurance seeking, pacing. So many different behaviors, really maladaptive behaviors, that I'm going to explain today how anxiety is often the underlying cause of these behaviors. So as I said, thank you for switching over the slide here. Anxiety is an extremely important topic in Fragile X syndrome. As you can see here, it's frequently cited as one of the most problematic symptoms of Fragile X syndrome. So in 2019, Jane Dixon Weber and a group of individuals involved in the Fragile X world published The Voice of People with Fragile X Syndrome and Their Families. So this was a report from a survey on the treatment priorities that was completed by 467 participants. So this included 439 family members or caretakers of someone with Fragile X syndrome, 20 professionals who work with a person with Fragile X syndrome, and actually 8 individuals with Fragile X themselves. Respondents indicated the 3 main general areas of concerns that were consistently problematic in the lives of people with Fragile X. And as you can see here, anxiety was indicated as the most problematic symptom of Fragile X. The second, I guess the most common or most difficult issue that was cited were behavior problems. So this was described as the concern, again, most difficult for family members and caretakers, but I would argue that many of which are the result of anxiety. And then lastly, learning and cognitive problems were the most consistently reported daily living concern. Anxiety was not only indicated as the most problematic symptom of Fragile X syndrome, but it was also described as the top treatment priority by family members and caretakers, professionals, and individuals themselves with Fragile X. So clearly, anxiety is a very important topic in this population. But why is anxiety so prevalent in Fragile X syndrome? So why did I name this presentation Fragile X syndrome, the anxious brain? Well, let's talk about it more. Let's move on to the next slide. So individuals with Fragile X syndrome are neurobiologically predisposed to significant anxiety. Okay, neurobiologically predisposed. What does that mean? So the nervous system and the brain in people with Fragile X syndrome, the nervous system and the brain are formed in a way that makes them more susceptible to or predisposed to experiencing high levels of fear and anxiety. So their brain is created in a way to where they are experiencing more levels of fear and anxiety than the neurotypical population. So why is this? A quick physiology lesson. So the amygdala, it's a small almond-shaped structure, it's in green here on the slide, is the part of the brain that is responsible for emotional processing, particularly the processing of fear and anxiety. The amygdala processes these emotions, the fear and anxiety, and then tells our body how to respond to that fear. It specifically determines how we act in a crisis depending on the information that we've received, right? So essentially, by integrating information from our environment, the sensory external inputs, it's going to generate behavioral outputs related to fear and anxiety. So just kind of simply stated, that amygdala controls our fear response. How does that work? So when we encounter something dangerous, something that provokes fear, the amygdala sends a distress signal to the hypothalamus. So you can see here where I have amygdala, hypothalamus. Okay. It sends that distress signal to the hypothalamus, which then activates something called the sympathetic nervous system. I know I'm saying a lot of words here, but what I want you guys to hear is the sympathetic nervous system, which is the fight or flight response, okay? So it activates this by sending signals through the autonomic nerves to the adrenal glands, okay? The adrenal glands then respond by pumping out the hormone epinephrine, which is also known as adrenaline. So what happens when we have a huge surge of adrenaline or epinephrine? We get our fight or flight response. So the amygdala is controlling this fight or flight response. And we've all experienced this, right? So something scary happens in your environment and you feel this incredible surge of adrenaline. Your heart starts racing and you feel scared and you react. So actually yesterday I was on an airplane. I've been traveling all weekend, and the fire alarm went off on the airplane. I was honestly terrified, and I immediately felt this surge of adrenaline, this fight or flight response, this activation of my sympathetic nervous system. So my heart was racing. I felt panic. Sorry for the slam door there. My daughter just went out the front door. So I wanted to flee. My fight or flight response was in overdrive, but I was in the air flying, so I was unable to do anything about this, right? So I just had to sit with my fear. I think another good example, and I'm going to use this as an example a little throughout, is if you were to see a bear, right? So if I see a bear, again, my amygdala is going to scream bear and send a distress signal to my hypothalamus, which is then going to activate the sympathetic nervous system and sets off my fight or flight response, okay? Because if I see a bear, my body needs to respond immediately without me thinking, without me doing any actual processing of this information. It needs to see bear and I need to run. Or maybe in another scenario, the bear's attacking my daughter. I'm not going to run in that scenario. I'm going to do my best to fight, right? So that is my fight or flight or my fear response. Interestingly, the amygdala has another function. It can actually retain information of previous dangers. So if you've had an experience that triggered your fear response, this fight or flight, and you encounter something similar in the future, your amygdala is going to have a similar response. You're going to feel that panic. The issue here is that it can often overreact. And I give the example a lot as seeing, I've experienced a bear. I've fought off a bear. I ran away from a bear. I mean, this is obviously exaggerated, but I go to the zoo with my family and I see a bear. I'm going to feel that heightened response, right? And it's possible that it might even overcome my logic. I know the bear can't get me, but I'm so nervous. I grab my family. I'm like, we're moving on. I can't handle this right now. I'm too anxious, okay? And so as I said, even though I know rationally this bear can't hurt me, my body's in overdrive and it is fleeing the situation. So in addition to the amygdala holding on to or retaining information from previous experiences, actually chronic overstimulation of the amygdala leads to an even more exaggerated fear response that can cause us to cause really an outweighing of the logical or more rational parts of the brain. And this is kind of important. So I'm gonna remind you of that in a minute, that again, chronic overstimulation causes the amygdala outweighs our logical train of thought. So why is this important in Fragile X syndrome? So what's going on here? So, and I'm sorry, I know I'm still on the slide, so I hope I'm not losing everyone. So in Fragile X syndrome, this is why this is so important. This amygdala, this part of our brain that is controlling our response to external stimuli that's causing us to be nervous is dysfunctional and overactive. So studies have actually demonstrated that there are denser neural connections within this structure in the brain, leading to overactivity and chronic overstimulation, or, as I said earlier, an anxious brain. These brains are predisposed to be nervous. So there is this exaggerated sympathetic nervous system reactivity, and it leads to what we call hyperarousal, right? Or overstimulation. So this hyperaroused fight or flight response. And this response is completely out of proportion to level of cognitive impairment, because as I said before, this overstimulated amygdala is completely outweighing logic. And so really, again, what does this look like? So simply stated, our kiddos with Fragile X are hyper-aroused. They are chronically hypervigilant. And something to us that seems really small or insignificant, or maybe we don't even recognize what a trigger is, can cause a dramatic fight or flight response. So I'm going to step back again to the bear analogy. I have my scary bear here on this slide. If something in your brain, your neurobiology, has caused your amygdala to be overstimulated, and these individuals with Fragile X, this overstimulated brain, everything in the environment can be a bear, okay? So example, let's say I have Fragile X. My mom took a different route to school today. She didn't prep me or let me know about this change because life is real. We were running late. There was traffic. She didn't have time to go through the schedule to explain to me we're taking a different route. The response in my brain, again, out of my control. This isn't a thought process. This is just physiologically occurring. There might as well have been an actual bear because the physiological response is the same. So my sympathetic nervous system is in complete overdrive. It's chronically overstimulated. And so this small change is going to lead to really full-blown panic. And what I'm going to experience is a fight or flight response. So what does that look like? I know you guys have experienced this. I'm going to try to get out of the car. I'm going to fight my way. So I'm going to flee or I'm going to fight or flight. So let's say I have decided that I'm going to fight my way out of this. This might look like aggression. I might start hitting my mom. I might start screaming or becoming verbally aggressive. Out of my control. My body's doing what it needs to do to protect itself, okay? Same thing with, literally opening the door and trying to get out of the car, right? So I'm trying to escape. Another possible reaction to this fight or flight response. There's a third common a response that we see, and really it's another form of flight and is just shutting down. And so I know you've probably experienced this before where our kids shut down because of this experience. And then it just seems like they're being just, obstinate and refusing to do anything. They have just shut down maybe for the rest of the day at school, all because of this, what to us seemed like a very insignificant change, but was a huge trigger for them. And so shutting down is really another form of flight. Kind of as I've described, this is really completely out of their control, right? And this is that aggression that we see in these kids. It seems like it comes out of nowhere, but it really is this huge fear response. And so I'm no longer thinking logically. My body is doing everything physiologically possible to survive, right? Essentially like seeing a bear. But what outsiders see as aggression, avoidance, refusal, when really my body's doing what it's supposed to do in response to fear. And so I'm thinking about this and how hugely impairing this must be to individuals and to their families and to their quality of life. And so what I want to do really quickly here is circle back to what we are celebrating today, right? So we are celebrating all that these individuals can accomplish in the face of this incredible anxiety. And I want to talk back to the airplane. So I'm on the airplane and I'm actually working on this talk and the fire alarm goes off. I immediately stopped working, okay? I was completely unproductive. I really shut down. I could not focus. I could not concentrate. I was just overcome with anxiety. And that's what they're experiencing, right? They just become completely overwhelmed and unable to function. And let's move on to the next slide here. And so this over-exaggerated fear, again, leads to these maladaptive behaviors, right? So this, you can have the fight response, the meltdowns, the screaming, or the flight response. But then kind of what I experienced on the airplane was sort of a disorganized state, right? So they can feel their behavior almost seems disorganized, like they're out of control. Their self-regulation decreases. We see a lot of the repetitive movements, right? Repetitive speech. Frequently, they actually lose access to their language and communication. Even in our kids who have pretty good verbal skills, they might lose the ability to communicate. And because of this disorganized state, they become unfocused, inattentive, or impulsive and aggressive. Unfortunately, once this process begins, it can be really hard to avoid a full outburst. So this is why it is not surprising that up to 86% of males with Fragile X syndrome meet diagnostic criteria for at least one anxiety disorder, right? Their brains are predisposed to having significant anxiety. And that's just meeting diagnostic criteria for an anxiety disorder. It doesn't mean that they're not all experiencing some level of anxiety at some point. Anxiety in Fragile X syndrome is often treatment refractory, meaning the treatment doesn't always work. We're going to go into some ways to kind of mitigate anxiety in a minute, but I think that's important to remember is that we can do all of these things, but at the end of the day, there's still this physiological process that's causing them to just have a heightened sympathetic tone, a heightened state of anxiety. And then it's not surprising, again, that it's ranked as a top priority for drug development by clinicians and caregivers. An important note that anxiety is incredibly prevalent, but the most prevalent anxiety disorder that we see in Fragile X syndrome is social anxiety. So 60% of males experience that, and about 55% of females experience social anxiety. Anxiety, again, is cited as the most impairing feature in children with Fragile X. And as we said before, it can manifest in many ways. And so I'm going to go into that next, I think. Next slide? I think that's what's next. Yes, okay, perfect. So based on what I've described here, then, it should not be surprising that so many different behaviors are actually a manifestation of anxiety in these kids. And so irritability. There's a chronic state of hypervigilance. So I would be irritable in that situation. There's increased irritability, again, out of their control. The aggression that we're seeing, that's really that fight response. Self-injury, that can be a form of fight or flight, getting out of the situation. By, let's say, if a child knows if they start headbanging, they're going to be pulled from that environment. And that can be really a way to lessen what it was, the situation that was triggering the anxiety. Increased avoidance. And again, I talked about that before, that avoidance being a form of flight. We see the somatic and GI symptoms, and that has, again, to do with the sympathetic nervous system. That autonomic nervous system affects the whole body, and including the GI system, that physical sympathetic nervous system activation that we talked about, that increased heart rate. A lot of times we see when our kids are becoming hyper aroused, they really start to flush. They get sweaty. We see some psychomotor agitation, behavioral dysregulation. Sometimes this can be misdiagnosed as ADHD. This can be the restlessness, right? The nervous movements, talking excessively, maybe even motor tics or laughing. You can laugh in the face of fear. That's actually a pretty common response. Fidgeting, crying. The repetitive speech, the repetitive questions, I think that is incredibly common. I hear that a lot. The reassurance seeking, these compulsions, perseverations. Interestingly, I know I go back to this. The only thing I could do on the airplane was seek reassurance. I mean, I couldn't jump out the window. I couldn't fight anybody, and I was so nervous. I didn't know what was going on. So I immediately, dug my little, ring the bell, asked the flight attendant, what's going on? Fortunately, it was someone vaping in the bathroom, or unfortunately, I'm not sure, but it wasn't a fire in the airplane. I immediately calmed down once I was reassured. But if we go back to the brain in these individuals with Fragile X, they seek reassurance, but it really doesn't. It's that chronically overstimulated amygdala that they get the reassurance, or they get the answer to their question, but they see the bear again, right? So what's for lunch? I'm going to tell you what's for lunch. Okay, well, I'm actually nervous about it again. So what's for lunch? Are we having this for lunch? I really don't like that other thing that you give me sometimes, so I'm going to keep asking you. Honestly, I'm going to keep asking you until it's in front of me. And we see that. We see that perseveration, the constant reassurance seeking. Again, I think I've said this before, but not just the avoidance, but just the flat out refusal, right? Just becoming unresponsive, completely shutting down, remaining silent, going into themselves, because it is really an evolutionary physiological response to safety, right? We see it in animals, actually, right? We see animals playing dead. That's a form of flight in nature and in humans, completely avoiding the situation. And we see social avoidance, social withdrawal. And then I said before, the hyperactivity. We see anxiety frequently manifest as hyperactivity, especially in younger kids. And then in older individuals, a lot of times we see pacing. Interestingly, that avoidance escape behavior is really more common in those with a limited ability to communicate, which makes sense. They have a harder way to communicate what they're feeling, and so they're just going to avoid and shut down. And then I want to point out too, this social withdrawal and phobia, this can evolve into full-blown reclusion. And I've seen this in my clinic, and I've read about this. This is really common in adults, in adolescents, our older teens, and our young adults, because they don't have the demands of a schedule, like going to school or getting out of their homes on a regular basis. And so this social withdrawal and phobia, like I said, can really evolve into just a true reclusion. So it's something to be mindful about as your child ages. So there are some observable categories of anxious behaviors. And again, I'm just going to kind of just to summarize what I've just said. So you have the increased irritability, aggression, and self-injury, commonly caused by anxiety. Again, this is kind of more of that fight, increased physical movement, the nervous activity, and the restlessness. We see that. The physical and physiological features of anxiety, which I already talked about, the increased heart rate, we've all experienced that. And then the internalizing and the gastrointestinal symptoms. A lot of times diarrhea or nervous stomach, we see that frequently. So what are some common anxiety triggers in Fragile X? So this was important, I think, to go over mostly so we can talk about ways to avoid these triggers or to help kind of treat some of this anxiety. So eye gaze. A lot of our kids are also diagnosed with autism. And what is like the number one thing that they do in the treatment of autism is they teach them to look at me, show me your eyes. We do not want to do this in Fragile X. Forcing eye gaze in individuals with Fragile X is just going to trigger this fear response that I've already talked about. They're going to shut down and they're not going to be able to learn. And so we never want to force eye gaze or eye contact in these kids. Being rushed, any change in routine, a lack of consistency or routine, new plans, not being prepped for these plans, making decisions. This is difficult for anybody, but giving someone the option, that can be really hard for them. So maybe minimizing maybe the options or kind of help guide them when making decisions, going from one place to another. Interestingly, so transitioning from one activity to another, but it's important to note this is even when from a preferred to a preferred activity. It doesn't necessarily have to be preferred to non-preferred. Just any transition can be very triggering for our kids. Items being out of place, it's very confusing and can be scary. Loud noises, crowds, close proximity to others. Crying children, we hear that a lot, and younger siblings, we have a new baby in the house and they're crying, and this is really hard for our older child. Unclear expectations, this is common in schools. Verbal instructions that are unclear, too rapidly spoken, or maybe not at your child's developmental level. having to wait without a clear understanding of the time requirement. That's frustrating for everyone, but it's really difficult for these kids. Any form of heightened emotion or excitement, even in a good way, this can be scary. Unexpected movement, visually distracting places, and then strong smells. These are all common triggers of anxiety in Fragile X that, again, like I said, stimulate that already chronically overstimulated amygdala. Next slide. So just a quick note again on social anxiety, because I talked about it before being common. So it really is present to probably some extent in all individuals with Fragile X. And this can range from just being shy to a true clinical diagnosis of a social anxiety disorder. What's really hard, though, is we know our kids are so motivated to be social, but they're just easily overwhelmed by the social interactions and expectations. And so a lot of times they become avoidant. And this is really difficult because we know how important socialization is for them and to them. Some triggers for social anxiety, they can kind of help that process. I said that backwards. Some triggers, and so avoiding them would be to help that. So being put on the spot, forcing eye contact, like I said before, standing up in front of people, making phone calls. This can be very hard. I'm sure you've experienced this. I've experienced this with quite a number of my patients, attending parties or large gatherings and meeting new people. And so helping them through these, not putting them on the spot, not directly asking them a question, maybe asking the group a question, things that can take away some or improve some of that social anxiety. Perfect. So now we're going to go on to some non-pharmacological treatment options. And then following this, we'll go through some pharmacological treatment options, So I feel like I've been saying all this, and I hope this isn't too negative, but there really are ways to help minimize this anxiety and really improve their quality of life. And so what treatments do we have? So from a pharmacological perspective, we have a lot of different things, but specifically therapies. And I want to point out speech therapy and occupational therapy. So speech therapy helps aid in communication. So this includes both our expressive language, so the ability to share our wants and needs, and then also our receptive language, so our ability to understand what's being communicated to us, right? And then there's also social communication. So improving all three of these aspects can greatly help ease anxiety. If you're nervous, but you can't communicate why you're nervous, or can't even communicate that maybe you don't recognize you're nervous, but you want to get out of somewhere, but you can't communicate it, that's incredibly debilitating. Same thing is if you have difficulty with receptive language and the instructions you're being given are extremely unclear, that's anxiety triggering. And then the social anxiety, improving communication can really help with our ability to socialize. And that's really important for improving quality of life. So in addition to speech therapy, augmentative communication, or AAC devices, are really important, as they can really help aid in communication and then help lessen anxiety. Occupational therapy is also really essential for these individuals. So an occupational therapist can help in a myriad of ways. They can provide calming techniques, and these can be individually tailored to your child's needs. They can help provide guidance on adapting an environment to lessen triggers. They can help help improve communication and provide something called sensory integration therapy, which can be really helpful in lessening anxiety. And so I would strongly encourage, if your child or if the person you care for is not in therapy, to pursue speech and occupational therapy. Unfortunately, these therapies are often phased out in adolescence and adulthood, and so that's a real hurdle that we face a lot. But if you can find someone in your area familiar with Fragile X, especially, who can provide speech and occupational therapy, I would really encourage you to pursue that. Another really important thing is avoiding triggers. So we talked about the triggers, and so some ways to improve anxiety is maintaining structured, predictable environments. Using clear and simple language, and expressing this to the teachers, right, or the maybe the caregivers at the day homes. Be clear and simple with expectations. Have consistent expectations and consistent routines and structures. Provide visual aids or visual supports. I put a little picture there on the screen as just a simple example. Providing ample personal space, right? They don't love crowds, and they don't like their personal space, encroached upon. And I get that. So, giving them, space. again, not demanding eye contact, and then limiting whatever the individual known trigger that is, whether it's a bright light or a loud noise or something like that, maybe a specific smell. Excuse me. One thing that is incredibly paramount is consistency. So a consistent response to challenging behaviors across settings and caregivers. And this is really difficult. I mean, in the real world, this is hard to do, but that consistency with routine and expectations is really important to reducing anxiety. And then lastly, just teaching techniques that promote calming and the communication of feelings. And I kind of touched on that with the therapies. So unfortunately, too, non-pharmacological treatments can have unpredictable and inconsistent results. Same with drug therapy, right? But in the vast majority of our kids, it might not eradicate the anxiety, as it's kind of impossible to do so because it's physiologic, but it can greatly improve their quality of life and the quality of life of their families. I just wanted to point out some resources that are available to everyone online. So Katie Clapp, she's the co-founder of the Fraxa Research Foundation, and she's also a parent of a young man with Fragile X syndrome. Presents a great webinar. It's on educating young children with Fragile X, but I think it's important because a lot of the strategies she talks about are really applicable to everyone with Fragile X. She talks about calming and how it's important to integrate it throughout one's day. Integrating the ones that work, and she gives some really specific examples, but I think what it's important is how to individualize it to your child. She talks again about not forcing eye contact because that's so important, but so many people don't understand that. Let me say this, outside of the Fragile X world, we know it, but our teachers don't know it, our therapists don't know it. And so that's something, even maybe our general pediatricians aren't aware of it. And so it's something that we need to educate. So that isn't, so that our child's not forced to make eye contact. And then again, avoiding environmental triggers. And she gives some other suggestions like using dim lighting and muting headphones and things like that. And then some other just resources I want to point out. There is a really fantastic guide on the Fraxa website. So this is a guide specifically for parents, and I really like it. It's just organized very well because, as you can see here, you can just kind of click on the different information that you're looking for. And there's a lot of good information. Coping for parents, anxiety and calming techniques, how to deal with loud noises, problem behaviors, all sorts of tips. So I'll ask you to take a look at that if you're looking for more information. Next slide. So now we're going to talk about some pharmacological treatment options. I'm actually not going to go into too much detail. All I'm going to say here is that we do have symptom-based treatment to target the most problematic behaviors in Fragile X. And so at this time, treatment is solely supportive, meaning we are treating the symptoms of Fragile X. We're not actually treating Fragile X. But there are a lot of medications in the pipeline and a lot of clinical trials that I would encourage you, if you haven't already, to really to do some research on the Fraxa website or on the National Fragile X Foundation website. There's a lot of links to different clinical trials that are currently underway. And so I will say, though, that pharmacological treatment is used commonly and very safely. Most individuals with Fragile X are treated with multiple medications for different behaviors. This is very common. Medications are heavily used alone or in combination, really to produce improvement in behavioral functioning in the majority of individuals with Fragile X. There are a number of medications that can be used to treat anxiety, and then there are a number of medications that can be kind of used to augment that treatment of anxiety for some of those other behavior issues that we see as a result of anxiety. And so just two more quick additional resources. There is a great medication guide for Fragile X on the Fraxa website. And then there's also a wonderful treatment guide. Well, there's just treatment guidelines in general, but specifically medication guidelines on the National Fragile X Foundation website as well. So if you're not familiar, if you're here today, you're familiar with Fraxa, I'm sure. But I encourage you to take a look at fraxa.org and fragilex.org and for a lot of information. So I think that concludes what I have prepared today.
Excellent. Thanks, Carrie. Um,
Absolutely.
that was great. And as I said, I have two boys with Fragile X. So yes, we totally know anxiety. And we do have some pre-submitted questions to go through.
Wonderful. Yeah.
So let's go with the first one. It was, my son has Fragile X, and one of the symptoms is his weight. He doesn't overeat or eat a lot of sweets and never has, but he just does not metabolize what he eats. This causes many health problems like gout, blood flow problems to his legs. How can a caregiver of Fragile X person help them control or lose weight without starving?
This is a very difficult question, and we actually see this a lot. We see this a lot of times it's described as the Prader-Willi phenotype, although I think the Prader-Willi phenotype of Fragile X is more of overeating. But we see a lot of incredible weight gain, but without a history of overeating, if that makes sense. And so what's happening is that they must, I mean, theoretically, they're not metabolizing calories as efficiently as they should, and they just really struggle with their weight. And so other than looking for hidden calories like juice, sodas, and things like that, also looking for sneaking foods. We do see that sometimes at night, getting into the kitchen in the middle of the night. I think it's important, though, besides looking for the hidden calories and looking for sneaking food, emphasizing the importance of physical exercise. So this can help speed up metabolism. Physical and occupational therapy can really help with this. In addition, I also encourage often like swim classes, swim therapy, that can really help burn calories. But I also want to mention metformin, because there's a lot of research coming out that metformin seems to be beneficial in social language and in behavior in Fragile X. Excuse me, not social language, just language in general. Expressive language is what I meant to say there. But it also aids in weight loss. My theory being here is there some insulin resistance or something going on in these individuals that's making it really difficult for them to lose weight. And so metformin can help regulate the issues with insulin and also cause weight loss. Another thing we frequently see in this population is treatment with neuroleptics or atypical antipsychotics like Risperdal or Abilify, and these can really cause increase in weight gain. And so metformin can kind of actually be given together at the same time to kind of, well, for the positive effects of the metformin, but also to kind of counteract that increase in appetite.
All right. Next question is how to control anxiety and aggression without medicine.
Okay, so kind of what we talked about today. I mean, this is a really good question. So as I've already said, we know these kids have very high levels of anxiety, and they struggle when they're overwhelmed and overstimulated or when their routine is thrown off. So I think outside of medication, it's just really important to pay attention to the environment and to recognize triggers, right? When you notice your child starting to become overstimulated, get them out of the environment or reduce the source of whatever that stimulation is if possible, or if that's not possible, remove your child from the triggering environment. And then in addition, what we talked about before is recommending therapies, occupational therapy, and speech therapy can really help a lot with anxiety and aggression.
Excellent. All right. Next question is, why do clinical trials have different participation requirements? Our low-end individuals never get these opportunities.
That's a good question. So there are a lot of clinical trials right now that will hopefully, if they get to the point of approval, will benefit all, right? So all ends of the spectrum of Fragile X. But the issue in a clinical trial is that you have to have an outcome measure, right? Something that's measurable. So for example, if you're studying a drug that is looking at language, you really have to have some level of verbal ability in order to measure an improvement or a decline, right? And so that I think is part of the reason why some of our lower functioning or maybe more severely affected individuals aren't included at this point. However, I do want to point, so communication alone shouldn't keep them from every trial. One trial that comes to mind specifically, we're a the sponsor of this webinar today is Harmony, and we're a clinical trial site. This is so the Harmony ZYN002 trial. So it's a topical CBD gel that is being currently provided to individuals with Fragile X, does not have severity of Fragile X as an inclusion or exclusion criteria. So this might be, whoever submitted that question, or for anybody, this might be something to consider, because that is all levels of severity are included in this trial.
Great. You were talking about ZYN002. There's actually a question related to that. It was, what countries is the trial of that available in?
That's a very good question, and I had to look that up because I was mostly familiar with the United States. But actually, this trial is currently available in the United States, the United Kingdom, Ireland, Australia, and New Zealand. And I just happen to know, but as a site, travel and some other expenses are covered. And so if your child is eligible, this is something to consider, absolutely.
All right, next question is, I have 2 daughters with Fragile X. A lot of these studies seem to be for males. Will more studies be opening up for females?
Fantastic question. So it is true that a lot of focus of the Fragile X research has been on males, I think specifically because they're usually more severely affected. But there are more studies becoming available to females. And I will say again, the Harmony topical CBD study is available to females ages 3 to 29. There's another clinical trial going on right now that our site is our clinic is a site that is not currently enrolling females, but I am hopeful that it will eventually open to females.
All right. Next question is, can you tell me more about behaviors during the monthly period of Fragile X women?
Yes, that's a great question. So I think in all Fragile X and not, right, hormones affect many aspects of life, and they can really affect mental health and behavior. And this occurs, like I said, in both typical developing females and those with neurodevelopmental disabilities. So what we see often around our monthly period is increased anxiety. Anxiety is extremely sensitive to hormonal changes, and so this can definitely worsen around menstruation. We can get increased aggression in our patients, and then some worsening of behaviors. A lot of times we see a dramatic increase in the perseveration and reassurance seeking, again, around, during this premenstrual period or PMS. Irritability, sleep disturbance, mood changes, appetite changes are also all common symptoms of PMS and also during menstruation. So there are some medications that can be helpful with this. So talk to your physician, or if your physician's not comfortable, maybe try to find a Fragile X clinic. But oral contraceptives can be very helpful with regulating hormones and then regulating mood and behavior around a monthly period. And then, of course, anxiety medications. So again, I would encourage you to talk about this with your physician. And if your physician isn't comfortable, maybe contacting a Fragile X specialty clinic. Also, there are some adolescent gynecologists who specialize in neurodevelopmental disabilities as well, who have a real wealth of knowledge regarding oral contraceptives and menstrual suppression. So that's another consideration. We send quite a few of our teenage girls to adolescent gynecologists because they're really educated on how to appropriately examine and interact with teenagers, specifically those with developmental disabilities.
All right. So the next question is, what experience do you have in older Fragile X adults?
So personally, I certainly see more. I see adults in my clinic, absolutely, but I see more young adults than I do older adults in my clinic. For whatever reason, I'm not sure what that is, but most of my patients tend to be probably less than 40, although I do have some older patients. Currently, our clinical trials, we have at our site, we have 2 clinical trials, one that goes up to age 29 and one that goes up to age 45. And so there are opportunities, and that's just our site, but these trials are being conducted nationally. There are opportunities for some of the middle-aged men, but not much as far as clinical trials for those in the older population.
All right. Next up is, What works best for aggression behaviors in adults with Fragile X?
For aggressive behaviors. Okay. So I would say, and this is in adults. Okay. So I would say this is very similar to in kids, right? So finding what's triggering them and eliminating it from the environment. I also think, especially if it's a nonverbal patient, or a nonverbal individual, looking for a source of discomfort or pain, because if, pain can really lead to aggression. And then look for environmental triggers of being overly stimulated. So I see a lot of excessive screen time in some of my patients, kind of the teenagers, adults. That chronic stimulation with an iPad or a screen can really be overstimulating and can result in aggression. And so that's something to consider as well. So in addition to, I think, environmental adaptations, this question just said works best for aggressive behavior. It didn't say non-pharma. Okay, so there's also medications that are available. So I think looking to see, is anxiety at the source of this aggression? Consider treating the anxiety. And there are other medications available as well that really help target irritability and aggression. A lot of these medications work well and are very safe. So again, I would talk to your physician and ask them, but if they don't feel comfortable prescribing medications to an adult with Fragile X, you could certainly reach out to one of the Fragile X clinics as well.
All right. So how best to deal with OCD in adults with Fragile X?
How best to deal with OCD in adults with Fragile X? Okay, so I would having a Fragile X specialist, I think, would be really helpful. Specifically to make sure this is true OCD and not just kind of more of the repetitive behaviors of Fragile X. However, that said, if it's true OCD or if it's repetitive behavior because of, let's say, underlying anxiety, both respond pretty well to SSRIs. OCD specifically usually requires higher doses of SSRIs, but SSRIs meaning selective serotonin reuptake inhibitors. So this includes Zoloft, Prozac, Lexapro. Those work very well for treating OCD behaviors and also some of the underlying anxiety. And so yeah, I would just recommend talking to your physician about that.
All right. Is it common for Fragile X adults to have a lot of muscle and back issues?
That is a good question, and it is very common. So the connective tissue is the tissue that holds together basically our body, such as skin, the tissue, that holds together our body. So such as skin, muscles, tendons, and ligaments. These are all connective tissues, right? So individuals with Fragile X actually have abnormalities or differences in their connective tissue. And so this can result in hyperextensible joints, meaning they hyperextend or overextend. And this can lead to joint dislocations. Flat feet are very common. This can lead to pain with walking. And so these connective tissue differences can certainly lead to pain. Another thing connective tissue abnormalities can cause is scoliosis or curvature of the spine, which can certainly lead to back pain and muscle pain. And so if your child is experiencing muscle or back pains, I would absolutely encourage them to be evaluated by their doctor, maybe referred to a physical therapist or possibly to a physiatrist or orthopedist to kind of help with these concerns. And I'm going to make a quick point. Not only do we see these concerns commonly in Fragile X, but we actually see them very commonly in Fragile X premutation carriers. So our moms frequently have very similar connective tissue issues. And so that's just something, I bet we have a lot of moms on here today. So that's something to consider as well. If you yourself feel you're experiencing some muscle or back pain, it could be because of these underlying connective tissue changes.
All right. Next question is, when considering long-term planning and future independence, what is the likelihood of independent living? Planning for future, do we plan to have our children live with us with support, or do individuals affected with this condition do better in a group home?
In a group home setting. Okay, okay. So basically, long-term planning, future independence. This is difficult to obviously answer on a webinar. I mean, this is incredibly situation dependent, right? So I have some adults who are thriving in group homes, and then I have some who do not. With a group home, it really depends on their daily living skills, so their ability, and also, unfortunately, their level of aggression. So some homes, can't tolerate too much aggression, and so that your child may not be eligible. Also, whether or not a home is really even available to you in your area, and then what they're able to provide to your child. They can also be very expensive, and so there are a lot of things to consider when deciding between what long-term goals you have for your child.
All right. Next question is.
It's definitely not an easy decision for sure.
Okay.
Sorry, say it again.
Sorry. I was starting on the next question. I thought you were done.
Oh, no, it's okay. I think I went out there.
Yeah. All right. So my son is 28 years old and has Fragile X. Do young adults with Fragile X develop sexual partners?
This is a great question. It is certainly extremely variable. Some do, but it is absolutely dependent on their functional level. So I think you know your child better than anyone. And so what would be most important for them is for you to make sure that they are capable of consent, that they aren't being taken advantage of, and that they aren't taking advantage of anyone else or being aggressive in their advances. And so I think that is obviously very individual based on functioning level. What I do want to also emphasize, though, if they do develop sexual partners, it is obviously very important to talk to their doctor, to talk about appropriate STI or sexually transmitted infection monitoring, and also oral contraceptives for the females or barrier method for our males. Very important considerations to take.
All right. Would you please address strategies for adults who have Fragile X with these issues?
Okay, so I think we've talked about this, right? So just basically the same strategies to the younger individuals. And I'm guessing because this was a anxiety webinar, the questions were about anxiety. So would you please address strategies for adults? Probably I'm thinking adults with anxiety and Fragile X. And so again, same strategies as the younger individuals, I think with the exception of including more social opportunities, because as we talked about before, adults with Fragile X don't really have the social responsibilities or opportunities that those in school are exposed to. And so this can cause them to lose social skills, maybe that they have learned, and some of their, the adaptations that they have developed to navigate society. And this can cause their social anxiety to worsen. And so what we see, and as I said before, is they can become very reclusive and retreat to their rooms. They become more easily triggered by external stimuli. So it's really important to keep them busy and outside of the home to kind of avoid this. But again, keeping those same techniques in mind. So if you're going to take them out, don't forget their muting headphones if that's what they had in school. Or, don't take them to crowded environments, but take them somewhere where they're still outside, they're still socializing, but you're still paying attention to those calming techniques. I think, again, as I said before, those non-pharmacological interventions help, but so do the pharmacological interventions as well. They're just as effective in adults as they are in children. I will mention too, unfortunately, a lot of our adults don't have the same opportunities available to them regarding therapy. But as I said before, if that's something that you can find, I would really encourage occupational and speech therapy to kind of help with regulation and overstimulation and that like hyper aroused brain, that anxiety that's on overdrive.
All right. Next question is, what about anxiety in carriers?
Well, that's a good question. Yeah. So this entire webinar was about anxiety in the Fragile X brain, right? Not specifically in the carrier brain. And so anxiety is really common in our Fragile X premutation carriers. We see a lot of social anxiety specifically. I actually, in my clinic, I see moms as patients as well, and I frequently treat them for anxiety. I find that SSRIs work quite well. So again, the selective serotonin reuptake inhibitors, Lexapro, Zoloft, Prozac, they can be very helpful, and as can cognitive behavioral therapy. So therapy working through working through that anxiety can be really helpful. Another important step, I feel like, in the treatment of anxiety is recognizing what it is, recognizing, oh, this is social anxiety. That's what's going on here. And so this is an important step, toward treatment. So I think really with medication and therapy, though, social anxiety and generalized anxiety, which we see also, and then other anxiety disorders can really be dramatically improved.
You go over like the causes and any treatments for hiccups, and could it possibly be associated with taking an SSRI like fluvoxamine?
Oh, yes. Okay. So I saw this question. So someone asked, treatment for hiccups, could it be associated with fluvoxamine? So, fluvoxamine is an SSRI, okay, and it's commonly used, as other SSRIs are, for anxiety, but fluvoxamine is specifically used for OCD usually and in high doses. So this was specifically about hiccups. So I'll touch on that. So SSRIs have been rarely identified as a cause of hiccups. So it's something to consider. All SSRIs can cause hiccups. But what's interesting with SSRIs, because they're the same class of medication, but you can have one SSRI that causes an individual to have a side effect, but another SSRI doesn't cause that side effect. So what I would encourage for this, or I'll just say in general, because I don't want to give specific medical advice, but maybe a trial of another SSRI is a possibility. The other thing with fluvoxamine specifically, though, so hiccups can kind of occur with all SSRIs, but fluvoxamine specifically is known to really dramatically worsen reflux, and reflux can be associated with hiccups as well. So that might be something to consider. So if reflux is maybe an issue, maybe consider treating that and seeing if it improves the hiccups. If it doesn't, then maybe trying another SSRI.
All right. Looks like we got time for one more question.
Okay.
And the last one will be, I'm looking for help and information on anxiety in a smaller child, say 3 years old.
3 years old. Okay. So I hope today's webinar addressed that, a lot of it, right? So a lot of the non-pharmacological treatments, right? The consistency, routine, speech therapy, occupational therapy. Environmental modifications. So those are certainly places to start. I will say that I have started medication in 3-year-olds for anxiety. Absolutely. There's some evidence that treatment with sertraline or Zoloft can not only improve anxiety in this age, but also can possibly improve expressive language. And so I feel very comfortable if the family's interested in starting medication at a young age. And I know a lot of the other Fragile X clinics do as well. But another thing to consider also is the Harmony CBD trial, because that trial actually does enroll down to age 3. So it's 3 to 29 males and females. And so that might be something to consider as well. So, I would certainly look at the I cannot talk this morning. Sorry. I think I have jet lag from my flight. Environmental modifications, and then therapies. But once that is stable and the anxiety is still persistent, I would really consider looking into enrolling in a clinical trial if it's something that would be a fit for your family.
All right. And that wraps it up for today. Thank you again. This was great. Very informative. I hope everybody enjoyed it. As we mentioned earlier, today is World Fragile X Day. I hope you go out, check out some of the illuminations this evening. There's several hundred of them. You can go to worldfragilexday.com to check them out. We have a full listing there. And that's all we've got for now. Anything else? Any last words, Kara?
I don't think so. Yeah, at our State House today in South Carolina, they're doing something, so that's really great. So a lot of recognition for World Fragile X Day. So it's really wonderful.
All right. Thanks, everyone.
Yeah. Bye. Thanks so much for having me. Bye.